Hey, welcome back, everybody. You know, normally when Dr. Shatkin is on AM Buffalo, he's in my studio. Today, I'm in his office here on Kensington Avenue. And what we're going to talk about is the fact that yours is the only office that will actually be able to do surgical and non-surgical fat reduction if that's necessary.
Right, surgical and/or
fat reduction.
And this is our fat studio, Linda. But we have one of our patients here is demonstrating the benefits of this new Sculpsure device. You know, we've talked about liposuction before, but this is fat reduction non-surgically using a laser. And the big advantage is there's no downtime, no discomfort. Easy recovery. In fact, we have the patients do activity right away. They can go to the gym, they can do anything they want, and there's really no downtime at all, which is really great.
What does this feel like? Is it cool? Is it warm?
Well, it's a laser, so it actually generates heat, but it goes through stages during the process, and it's a 25-minute treatment, so it's very quick. During that treatment, it'll get hot, and then it'll give a burst of cool to settle it down, and then it'll get hot again, and it goes through this cycle, and we have an attendant that stays with him, one of our estheticians, cosmetologists, or our nurse. As you know, we have Kathy has been our nurse for many, many years, and we have physician's assistants as well, and sometimes I'll supervise the treatment, but it's really very simple and straightforward.
Now, this is going to be great for trouble spots, but for those people who need more than that, you can also offer them the surgical treatment, and that is usually liposuction, and you're holding the cannulas to show people
I want to show
how this actually works.
I'm glad you brought that up, Linda, and I'm going to show the cannulas in just a second, but what's really interesting is that in our practice, not only we do provide the fat reduction, but we also give the counseling for nutritional counseling to help them achieve that, and if they can't get all of that fat off, if they just end up with some localized fat, that we can help them. And the advantage that we have in this office is we can show them what the best treatment would be, whether it's non-surgical, which we just demonstrated with the Sculpsure, or it's surgical, which we do with cannulas. Now, what's interesting, and we talked about this on the air before, and I don't know if the camera can pick this up, these are the cannulas we used to use. The smallest one we used to use, and this is when I just finished my practice back in 1989, was 6 millimeters. This particular one is 10 millimeters. The largest one we use now is 4.7 millimeters. This happens to be a 2.5 millimeter one. You could see the distinct difference between these two cannulas. And that's why we're now calling it not liposuction, but liposculpting.
Ah, yes.
So we're doing liposculpting with fine cannulas at different lengths and different dimensions. And we're doing sculpting with the Sculpsure device, which is non-surgical. And very often we can use both or one or the other.
I like that because there are some places that offer only one of these things, and then you end up not getting, I think, the result you want because you're going from one place to another. And I think a lot of times they're not exactly honest with the result you can achieve. But here, what we want you to know here at the Aesthetic Associates is that you start with counseling, they start with good nutrition. Then, if you're looking for non-surgical fat reduction, you have the Sculpsure. But if you do need the surgical fat reduction, you can start with the lipo and then also go to the short Sculpsure after that.
Right. Well, you know what's interesting? When I was in my residency getting trained, my professor once said that if all you have is a hammer, the whole world looks like a nail. And sometimes you try to fit something into a treatment plan that probably isn't ideal. But because we offer the fat reduction with nutritional counseling, the fat reduction with non-surgical methods, and now the fat reduction with the surgery, we basically fit the right treatment for the patient.
Yeah, and everybody's unique, and so are your services. I think that's great, Doctor. Thank you so much.
Well, we love the holistic approach here, and we've been doing that now for decades. And we're at the Aesthetic Associates Center in Amherst, and we're adding on to a new facility, which should be done within the year. So we're really excited about that as well.
Yeah, you're going to notice they are growing. The Aesthetic Associates here on Kensington Avenue. Give them a call and find out what approach is going to be best for you. Tennyson Court is making memories every day. Just listen to what family members have to say.
They give her this wonderful sense where even